everyone, it's Nicole from the Physio Crew, and you probably found this video because you're searching for how to help lower back pain. Now, lower back pain is something that affects lots and lots of people. I have personal experience of it, so I know how horrible it can be and how intense the pain can be. What's really important is to understand that although the pain can be really bad with lower back pain, it's not normally linked to any sort of sinister feature, even though it can be extremely painful. So the common myth with back pain is that you should lie down and stay still. That is the worst thing that you can do. Move as much as you can, even if you've been stuck with lower back pain. If you've been stuck, then check out the other video which describes specifically that type of problem. But try and move, because what's happening is the muscles are really tight. They've often gone into spasm, and the reason we get the pain is because there's a lack of blood and oxygen in that area. It's called ischemia, and that can be pretty uncomfortable, but it's not going to give you long-term damage, although it feels really frustrating not to be able to put your socks on, not to be able to get down on the floor. It will get better. So I'm going to show you now just some really gentle exercises that you can do. This video is not to replace the advice of your healthcare professional. Go and get sorted. There's 3 things that you need to really think about that you need to see emergency care for. So if you have incontinence, if you can't feel your bowel or your bladder, or you can't feel in between your legs in the groin region, then that means you need to attend A&E. If you have gross weakness in your legs, that's not just a bit of weakness when you're going to stand up, but you can't feel your legs, again, that's ambulance or A&E. Or if you've got tingling in both of your legs, not one leg, but both of your legs constantly, then those are the 3 things that we call red flags. That could mean there's something more sinister going on. And if you're getting a fever is the other one. So if you're getting a fever, if you've got numbness in your groin region or in both of your legs, if you're getting tingling in both of your legs, or if you've become incontinent, then we need to seek immediate medical attention. If you haven't got those things, then try these exercises nice and gently to try and get it moving. Don't lie down for long periods of time. Sometimes heat can help if it's a muscle type problem, but if there's inflammation, sometimes heat reacts. It moves the chemicals around a little bit. Sometimes that can aggravate symptoms. So with heat, you could try it for a short period of time. If it feels better, repeat it. So you put sort of a hot water bottle, wrap it in a tea towel on the area for 20 minutes, and you might apply that sort of 2 or 3 times throughout the day. Some people advise cold, but in my experience, unless it's just you're trying to numb the pain, sometimes if it's a muscle spasm, it doesn't like cold. So I would stick with the heat and try some gentle exercises, and obviously go and see your physio. So I'm just going to go and have a little lie on the bed, and then I'm going to show you these exercises now. That down a second. So I wouldn't recommend necessarily getting onto the floor if you've got back pain, because it's hard to get on and off the floor when the back's very sore. But what we're trying to do is get a little bit of movement at the lower part of the back. So start by just bringing your knees over gently to the left and then to the right, keeping your tummy nice and relaxed. It used to be that everyone was sort of saying to contract your tummy muscles, but what we know about the spine is actually when there's muscle spasm, it's not that we've got too much movement and it's unstable. It's not unstable at all. It's actually that it's so rigid, that's what causes the pain. So we want to imagine that we're sort of like a chimpanzee, really loose and relaxed, and just bringing the knees over from left to right. Again, you don't need to throw them right over to the end of the range, just gently moving them, and then bringing your knee to your chest. So we do one leg and then the other leg. You can do them both at the same time, but that puts quite a lot of strain on the back. So often if you're in the acute phase, if it's happened within a few days, you just want to very gently persuade it. That's what we're trying to do, is just to say to the back, just relax. That alarm system has gone a bit nuts, and we're just trying to say to the brain, relax those muscles and just reduce my pain. The next one is a pelvic tilt, which is just imagining you've got a small orange in the back, underneath in the small of your back, and you're just squashing the orange down, so you're rotating the pelvis, causing a little bit of a stretch at the lower part of your back. So those 3 exercises are nice gentle ones that you can start to try and get a little bit more flexibility in your back, so that you can start feeling a little bit of relief. Take your painkillers as prescribed by the pharmacist, nice and regularly, and make sure that you're sticking with it. What I often see is that people sort of feeling a bit better, do some exercises, feel better, and then they stop the exercise. You need to be doing this every single day. Non-specific lower back pain affects 80% of the population, and the evidence is really strong. You need to exercise regularly. Now, sometimes it's difficult to know what exercise is right for you depending on the type of back pain that you have, so go and see a professional.